Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A client reports having thoughts of being followed by foreign agents who are after secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? 1. I don't see any foreign agents. 2. I think these thoughts are frightening to you. 3. I don't know what you mean. 4. I'd like you to come to group with me right now. The correct answer is 2. The client's disturbed thought process likely reflects this client's paranoid delusions. The nurse should acknowledge that the thoughts are frightening the client. Telling the client the nurse does not see any foreign agents is an appropriate nursing response if the client is having disturbed visual sensory perception and is having visual hallucinations. Telling the client the nurse does not understand what the client means is an appropriate response if the client has impaired verbal communication. Suggesting that a client participate in group activities would be appropriate if the client had a nursing diagnosis of social isolation and was staying in his room. A 24-year-old client, G3, P1, at 32 weeks gestation, is admitted to the hospital because of vaginal bleeding. After reviewing the client's history, which of the following factors might lead the nurse to suspect abruptio placentae? 1. Several hypotensive episodes. 2. Previous low transverse cesarean birth. 3. One induced abortion. 4. History of cigarette smoking. The correct answer is 4. Although the exact cause of abruptio placentae is unknown, possible contributing factors include excessive intrauterine pressure caused by hydramnios or multiple pregnancy, cigarette smoking, alcohol ingestion, trauma, increased maternal age and parity, and amniotomy. A history of hypertension is associated with an increased risk of abruptio placentae. A previous low transverse cesarean section and a history of one induced abortion are associated with increased risk of placenta previa, not abruptio placentae. A 16-year-old unmarried premigravida client at 37 weeks gestation with severe preeclampsia is in early active labor. The client's blood pressure is 164/110. Which of the following will alert the nurse that the client may be about to experience a seizure? 1. Decreased contraction intensity. 2. Decreased temperature. 3. Epigastric pain. 4. Hyperreflexia. The correct answer is 3. Epigastric pain or acute right upper quadrant pain is associated with the development of eclampsia and an impending seizure. This is thought to be related to liver ischemia. Decreased contraction intensity is unrelated to the severity of the preeclampsia. Typically, the client's temperature increases because of increased cerebral pressure. A decrease in temperature is unrelated to an impending seizure. Hyperreflexia is not associated with an impending seizure. Typically, the client would exhibit hyperreflexia. When preparing the room for admission of a multigravida client at 36 weeks gestation diagnosed with severe preeclampsia, which of the following should the nurse obtain? 1. Oxytocin infusion solution. 2. Disposable tongue blades. 3. Portable ultrasound machine. 4. Padding for the side rails. The correct answer is 4. The client with severe preeclampsia may develop eclampsia, which is characterized by seizures. The client needs a darkened, quiet room and side rails with thick padding. This helps decrease the potential for injury should a seizure occur. Airways, suction machine, and oxygen also should be available. If the client is to undergo induction of labor, oxytocin infusion solution can be obtained at a later time. Tongue blades are not necessary. However, the emergency cart should be placed nearby in case the client experiences a seizure. The ultrasound machine may be used at a later point to provide information about the fetus. In many hospitals, the client with severe preeclampsia is admitted to the labor area, where she and the fetus can be closely monitored. The safety of the client and her fetus is the priority. A laboring client with preeclampsia is prescribed magnesium sulfate 2 grams per hour IV piggyback. The pharmacy sends the IV to the unit, labeled magnesium sulfate 20 grams per 500 milliliters normal saline. To deliver the correct dose, the nurse should set the pump to deliver how many milliliters per hour? Blank ml. The correct answer is 50 milliliters. You set up the formula as 500 milliliters over 20 grams multiply by x over 2 grams. You cross multiply and get 1,000 equals 20x. You divide 1,000 on both sides and you get x equals 50. 12 hours after cardiac surgery, the nurse is assessing a 3-year-old who weighs 15 kilograms. The nurse should notify the surgeon about which of the following clinical findings? 1. A urine output of 60 milliliters in 4 hours. 2. Strong peripheral pulses in all 4 extremities. 3. Fluctuations of fluid in the collection chamber of the chest drainage system. 4. Alterations in levels of consciousness. The correct answer is 4. Clinical signs of low cardiac output and poor tissue perfusion include pale, cool extremities, cyanosis or mottled skin, delayed capillary refill, weak, thready pulses, oliguria, and alterations in level of consciousness. An adequate urine output for a child over 1 year should be 1 milliliter per kilogram per hour. Therefore, 60 milliliters per 4 hours is satisfactory. Strong peripheral pulses indicate adequate cardiac output. Drainage from the chest tube should show fluctuation in the drainage compartment of the chest drainage system. The fluid level normally fluctuates as proof that the apparatus is airtight. On about the 3rd postoperative day, the fluctuation ceases, indicating the lungs have fully expanded. Clients who have had active tuberculosis are at risk for recurrence. Which of the following conditions increases that risk? 1. Cool and damp weather. 2. Active exercise and exertion. 3. Physical and emotional stress. 4. Rest and inactivity. The correct answer is 3. Tuberculosis can be controlled but never completely eradicated from the body. Periods of intense physical or emotional stress increase the likelihood of recurrence. Clients should be taught to recognize the signs and symptoms of a potential recurrence. Weather and activity levels are not related to recurrences of tuberculosis. What is the rationale that supports multi-drug treatment for clients with tuberculosis? 1. Multiple drugs potentiate the drug's actions. 2. Multiple drugs reduce undesirable drug adverse effects. 3. Multiple drugs allow reduced drug dosages to be given. 4. Multiple drugs reduce development of resistant strains of the bacteria. The correct answer is 4. Use of a combination of anti-tuberculosis drugs slows the rate at which organisms develop drug resistance. Combination therapy also appears to be more effective than single drug therapy. Many drugs potentiate or inhibit the actions of other drugs. However, this is not the rationale for using multiple drugs to treat tuberculosis. Treatment with multiple drugs does not reduce adverse effects and may expose the client to more adverse effects. Combination therapy may allow some medications to be given in reduced dosages. However, reduced dosages are not prescribed for antibiotics and anti-tuberculosis drugs. A client is being successfully treated with clozapine. Which of the following statements by the client reflects a need for further teaching about managing the drug's adverse effects? 1. If I eat too many fruits, I'll get constipated. 2. I need to take the medicine with food to avoid nausea. 3. I have to get up slowly so I don't get dizzy. 4. Sometimes I have to push myself because I'm sleepy. The correct answer is 1. Clozapine is the one atypical antipsychotic associated with severe anticholinergic adverse effects, such as constipation. Consuming fruits would not be the cause of the client's constipation. The client should take clozapine with food to avoid nausea. Getting up slowly indicates that the client understands that postural hypotension may occur with clozapine. The statement about sleepiness indicates that the client understands that sedation may occur with this drug. When developing the plan of care for a client who is staying in his room because he perceives that staff want to harm him, which of the following outcomes of care planning is most realistic? 1. Within 2 days, the client will complete activities of daily living. 2. Within 3 days, the client will participate in recreation with other clients. 3. Within 4 days, the client will demonstrate an absence of verbal aggression. 4. Within 5 days, the client will seek out staff to talk about feelings. The correct answer is 4. The client is exhibiting suspiciousness of and a lack of trust in the staff, not aggression. Seeking out staff indicates the development of trust and decreased suspiciousness. Although completing activities of daily living and participating in recreation with other clients are important, the major problem presented is related to the client's isolation and perception of being harmed, not, for example, showering, hygiene, or other clients. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests that the nurse move away from the window. The nurse recognizes that doing as the client requested is contraindicated for which of the following reasons? 1. The action will make the client feel that the nurse is humoring him. 2. The action indicates nonverbal agreement with the client's false ideas. 3. The client will then think that he will have his way when he wishes. 4. The nurse will be demonstrating a lack of composure over the situation. The correct answer is 2. The nurse's nonverbal behavior, moving away from the window as the client requests, indicates agreement with the client's false ideas. The client's behavior is likely to be reinforced if the nurse takes steps to agree with the false ideas the client holds. The nurse is caring for a 22-year-old G2, P2 client who has disseminated intravascular coagulation after delivering a dead fetus. Which finding is the highest priority to report to the healthcare provider? 1. Activated partial thromboplastin time of 30 seconds. 2. Hemoglobin of 11.5 grams per deciliter. 3. Urinary output of 25 milliliters in the past hour. 4. Platelets at 149,000. The correct answer is 3. Urinary output of less than 30 milliliters per hour indicates renal compromise and would be the most important assessment finding to report to the healthcare provider. The APTT is within normal limits, and the hemoglobin is lower than value for an adult female, but within normal limits for a pregnant female. Although the platelet level is slightly low and may impact blood clotting when compared to renal failure, it is less important. A preemie gravida client with severe preeclampsia exhibits hyperactive, very brisk patellar reflexes with 2 beats of ankle clonus present. The nurse documents the patellar reflexes as which of the following? 1, 1 plus, 2, 2 plus, 3, 3 plus, 4, 4 plus. The correct answer is 4. These findings will be documented as 4 plus. 1 plus indicates a diminished response. 2 plus indicates a normal response. 3 plus indicates a response that is brisker than average but not abnormal. Mild clonus is said to be present when there are 2 movements. A preemie gravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated. Although the application of cool compresses may ease the pain temporarily, this would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. The mother of a child hospitalized with tetralogy of Fallot tells the nurse that the child's 3-year-old sibling has become quiet and shy and demonstrates more than a usual amount of genital curiosity since this child's hospitalization. The nurse should tell the mother, 1. This behavior is very typical for a 3-year-old. 2. This may be how your child expresses feeling a need for attention. 3. This may be an indication that your child might feel responsible. 4. This may be a sign of depression in your child. The correct answer is 2. According to Erickson, the central psychosocial task of a preschooler is to develop a sense of industry versus guilt. Any environmental situation may affect the child. In this situation, the sibling is probably feeling less attention from the mother and trying to resolve the conflict in an inappropriate way. 3-year-olds are usually active and outgoing. These behaviors represent a change. Symptoms of depression would include withdrawal and fatigue.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.